It's great to have you here, Susan.
Hey, thank you so much for having me. This is so fun.
How are you?
Yeah, exactly.
I'm great, thanks. How are you?
I'm great.
Good.
So, Susan, right off the top, for those who are unaware of the North Shore Health Program, if there are those out there, can you just sort of give us the A to Z on what that's all about?
Sure. So the North Shore Health Project offers support services for people who have HIV and/or AIDS, hepatitis C, and substance use disorder. We offer case management. We offer testing for the general public. Anyone can come and be tested for Hep C, HIV, and STDs. We also have Narcan. We are a Narcan supplier for both Gloucester, Greater Cape Ann, as well as all the way out to Salisbury and Haverhill. And we are a needle exchange program. So we take in used syringes and we replace them with clean syringes for folks to take along with them. We are a true harm reduction model. We meet people where they're at and we help them along their journey, and we keep them healthy and safe while they are on their journey. And should they decide to stop using drugs, we also are an avenue to get them start getting them into some treatment. But we're not a treatment facility per se. We're more of a harm reduction model where we just help people be healthy and safe while they're on their drug journey.
So just to keep on subject, I think we should ask you to identify the places, like where your headquarters are, where the needle exchange program is, where the testing is. Do you want to say that?
Yep. So we are at 5 and 9 Center Street. So it's the buildings are right next to each other. We're right across from the dog grooming place. Canine Cuts. And the barbershop is right there, around the corner from Passports, right off of Main Street. Our 5 Center Street location is primarily for our HIV clients. That's how we started in 1988, helping people with HIV and AIDS. That's where the Health Project had its origins. And then 9 Center Street is where we do the testing, the syringe exchange, Narcan exchange as well. We also have a mobile van. We have a grant through Mass Heals, which is funded by Boston Medical Center, and we have a mobile van, and we use that van in Gloucester. We go to certain places in Gloucester where we know folks are going to be, where if they're not comfortable coming right downtown. And then we also go to Salisbury and Haverhill and Ipswich. Additionally, with that money and with a substance abuse grant, we also do overdose follow-ups in Essex, Manchester, Ipswich, Beverly, Haverhill, and possibly Salisbury. We're trying to get into Salisbury with overdose follow-ups, working with their local police departments to give folks what they need once they have had an overdose recovery, sort of help them continue to be safe and healthy.
So there is really horrific news about drug overdose deaths in this country right now. Do you want to talk about that and what you're seeing in the community?
Sure. So, yes, unfortunately, it's not what the heroin that folks have been using is not what it used to be. And very often it's laced with fentanyl. People don't realize that it's got fentanyl in it, which is much more devastating than for an overdose than it is if you're just using heroin. And so people are using it unknowingly. They're unknowingly getting heroin that has fentanyl in it. We also, there's a bit of a stigma and a fear of being caught doing something illegal. So sometimes when there's an overdose, people, you're supposed to call 911, and you really do need to call 911. Narcan will revive the person, but if you don't get them help, they could go back into overdose, and it's really very important that they go to the emergency room to be checked out for their general overall health and to make sure that they come out and they're not going to relapse back into the overdose. There are people who are afraid to call. Naturally, they're afraid to call 911. So unfortunately, sometimes those instances will result in a fatal overdose. People are using alone. COVID has had a real impact, a very negative impact on everybody, right? But certainly for people who use drugs, they have been isolating because they know they can't really go out and socialize much, so they're people using alone, and that is also a dangerous precedent.
And I was going to ask how the Health Project's navigating through the pandemic. How stressed is the staff?
Oh, well, we've had a lot of turnover.
Yeah.
In March of 2020, right, everything closed down and we had to close our doors. We were an essential operation, so we could technically stay open, but we couldn't let clients come in. We just didn't know what, right? Nobody knew what was going on.
right.
Everybody had to close down. We did our case management, so Brian King of What Time Is It, Mr. Fox, is our HIV case manager, and he and Jason Brisboy, who is our assistant director at the Health Project, they continued to reach out to the HIV clients and the Hep C clients through phone calls and Zoom meetings, and they really tried to keep a very close connection with our clients, which is difficult. Even more difficult was reaching folks from the one-stop program for the harm reduction program. We try to supply folks with telephones for we have a large population that is unstably housed at the one-stop program. So keeping in contact with people who don't necessarily have a phone or all of a sudden had nowhere to charge their phones because they're homeless and they can't come into the Health Project or the library or anywhere to plug their phones in to charge them, to make sure that when they're out in the woods at night, if they need something, they can get it. It was a very difficult time for us, but we managed to keep the doors open. We are coming back into a somewhat normal situation right now. Keep our fingers crossed. Wednesday, we had our Thanksgiving meal that is lovingly provided by Fred Cowan, who supports our Thanksgiving meal. We had about 35 clients in having a meal. What could be their only Thanksgiving meal all together as a Health Project family, and that was really a wonderful thing.
Very nice. And Susan, what sort of work does the project do with the Open Door? Because Julie asked us to invite you onto the show specifically to talk about.
Sure. So and this is another, going back to our COVID protocol again, we have long gotten groceries from the Open Door. Groceries are available to anybody who comes to the Open Door who needs them. Our clients, many of them, it's a difficult trek for them to get here, physically to get here. And as folks come in for case management or holistics or whatever they're coming into the Health Project for, it made sense for us to have a little grocery store there. So we get weekly groceries from the Open Door, and then we are able to give our clients groceries, right? So it's one-stop shopping really for them.
Right.
And if they come in for groceries, then if they haven't done an assessment or we just need to check in with them, we're able to do that because it's a hook. The food is a little bit of a hook, and it's also a much needed benefit for them. I will say that for our unstably housed clients, cereal is great because you don't need to cook it. You don't need to add anything to it. You can eat it out of the box. Many things that are donated are really donated with the idea of people being able to access some way to cook it or to heat it up or to, so sometimes that's difficult. So anything that is pre-made, you don't need to heat it up. You don't need to cook it. You don't need to add anything to it. Is always a wonderful donation for people who are unstably housed. And then during COVID, during those 20 months or forever, I can't remember how many months it was, 1,000, we also delivered groceries weekly. So Jason and or Brian would go out and deliver groceries to our clients who couldn't get out of the house.
Wow.
So is there anything the community can do to support you, particularly going into this holidays, into the winter?
Sure,
Yeah.
sure. That's a great question. We accept donations. We get a lot of our money from the state. We have 2 large state contracts with the Department of Public Health and the Bureau of Substance Addiction Services, and we're so grateful for that. That covers our overhead. But it doesn't cover things like groceries and food and client transportation if we need to get somebody to a detox or something. So we are always accepting monetary donations. We will start looking for volunteers again now that we're somewhat out and up and running. We also love information about the difficulties that the community find with the drug-using population. For example, we were at a Friends of Dogtown meeting last night talking about syringes, et cetera, that they're finding up in Dogtown. So that is an ongoing issue. I will say that since July 1st, we have collected 80,000 syringes. And that's just since July 1st.
Oh my gosh.
People bringing them to us in exchange and also just, being mindful of, the collection of syringes. So we're always looking for that sort of helpful information so that we can help keep the entire community safe, not just our drug-using population, to make sure that we are respectful in the entire community and the greater community to keep the entire area safe and healthy.
Wow, what
Thank
a
you
big
for
tip of
that.
the cap to your group.
Yeah,
So Susan, if people want to learn
Thank
more
you.
about the North Shore Health Project, how can they go about doing that?
So I'd love for them to stop by 5 Center Street. We're always willing to show people around now that we're open. You have to wear a mask. We are a public health agency, so we are required to wear masks in our spot still. But you can also go to www.healthproject.org and learn more about us, and there's a donation portal on the website.
Very
Wonderful.
nice.
Thank you so much for coming.
Thanks for having me. Thank you very much. Happy Thanksgiving.
Thank you, Susan,
Thank
so
you.
much.
Good
We
luck to all
appreciate
your
your
team.
service to the
Thank you.
community.